So Jessica, as a counselor then, when the outcomes come in, that's when the patients now have to face a lot of decisions to make, because there are different types of ideas you will get, different types of outcomes you will get, positive, negative, variant of uncertain significance. Jessica, when you look at these three, certainly the first one is the one that has the greatest impact on the patient right there, to find out that, yes, there is an issue here. But I would also imagine, too, that from a counseling standpoint, the uncertain significance, that too, that's a dark black hole there that the patient doesn't know. These are all very difficult, 2 or 3 of them very difficult to deal with. You have to counsel them correctly.
Absolutely, and this is one of the reasons why it's important that people have genetic testing done with the guidance of a genetics professional. When it's a variant of unknown significance, so it's an inconclusive genetic test result, it doesn't explain a cancer diagnosis, it doesn't explain why someone has a family history of cancer, but it's a result that needs clarification over time. So we make sure that the patient understands that this is something that is benign until proven otherwise, to minimize the anxiety that may result from this genetic test result, but it is something that should not be discarded. It's something that needs at least yearly follow-up, so we can discuss any updates from the scientific perspective. Have other people been found to have the same genetic test result? Has the laboratory obtained additional evidence that classifies the result, as negative, which happens about 90% of the time? Only 10% of the time those results are reclassified to be positive. So 10% is still a significant number, and we definitely would like to accompany the patient and be there and provide the necessary guidance if that result is reclassified as positive.